All right. So what I want to point out, again, as we do these, they should be getting easier and easier and easier to visualize. But I want to point out a couple unique things about the shoulder uh, right off the bat. And that is these two uh, groups of what looks like separate muscles that have the little circle in them. Those are fan-shaped muscles that I experimented because the circles, I came up with all the circles because that's just how my brain works. So I'm still, even after all this time, I'm still playing with different ways to see certain things more optimally. So if you recall, we had our gluteus medius and minimus, which all the fibers were abductors, but only the anterior fibers were internal rotators, right? For the shoulder, we have our deltoid. This is a right deltoid. Now, you guys are familiar with hearing deltoids, plural. And that plural can mean two different things. If you work in both shoulders, your right and your left, it's plural. But in this fan, we have an anterior portion of that muscle, we have a posterior portion of that muscle, and then we have a middle part. Okay? It's like saying North Louisiana, Central Louisiana, and South Louisiana. It's one state, but we have different areas that might have different cultures. Maybe, I don't know. You think North Louisiana and South Louisiana have a little different culture, right? Just a little bit. But we're still part of the same state, right? And so that's kind of how this works. So what I meant to do by trying this is to show you, hey, this is one state, this is one muscle. However, the different areas pull in different directions in some planes. In other words, the posterior fibers actually do cross posterior. The anterior fibers actually do cross anterior. The posterior fibers actually do try to pull externally or laterally. And the anterior fibers do try to pull medially or internally. Does that make sense? That's what and again, we're going to go through, we're going to look at the pictures, but I just wanted to toss out, this is different because I'm trying new ways to not have to be redundant. The pectoralis major, all of the fibers pull this way and try to rotate this way. However, only the clavicular fibers cross anterior to be shoulder flexion tips. So I'm trying to communicate, hey guys, this is all part of one muscle, but only these fibers have this different function than all the rest of the fibers. That was my answer. All right, so here's your shoulder. Here are all of your functioning muscles. Let's look at and see if we see some familiar faces. Subscap, no. Teres minor, no. Infus medius, no. Supra, no. Those are rotator cuff. Hey, we've seen this, biceps brachii. We're going to go into the specific heads. We've seen triceps, head, awesome. So it looks like a lot, because it is a lot, but we've had at least a couple before, right? And who's not interested in the rotator cuff? That's always fun to talk about. So let's start with the rotator cuff. Well, you know, I always try to give you a visualization of all the different muscles all together and how confusing it all is. And so that's why we break it down muscle by muscle, part by part. All right, let's start with the deltoid. Deltoid is one muscle. Guys, I'm going to ask you that on the test. I'm going to ask you that on the test. I'm going to say, how many individual muscles make up the left deltoid, or how many individual muscles make up the right deltoid? And the answer is one. It's one muscle. On these fan-shaped muscles, they all have something in common. If it's one muscle, it's got to have something in common. If it didn't, it'd be a different muscle. But not all the areas of the fan have to pull in the same direction, okay? Another misconception is the middle part. A lot of people mistake middle for medial, which makes zero sense because the whole deltoid is on the lateral part of the arm, right? So how can you have something medial on the lateral? So it's middle. It's just the piece in the middle. So all of the fibers cross the shoulder laterally. That's why they pull in a direction of abduction. So they're abduction pullers. See this little blue area called the deltoid tuberosity? That's where they're pulling at. Middle part of the arm. Okay. So all of the fibers are abductors. So again, on the test, if I say, how many functions does the deltoid, and I'll usually say the right or the left. That's no different than saying, how many functions does the biceps brachii have? All the heads. What do all the heads do? All of the heads only pull one way. Pull in the direction of abduction. So that way the front cancels out the back, sagittally cancels out the back, and front transversely. So the deltoid is one muscle. The anterior, the front fibers, cross the shoulder in the front, thus making them shoulder flexion pullers, and they have an obliqueness to them. That's why they're internal rotation. So the anterior fibers have three functions: abduction pull, flexion pull, internal rotation pull. Very similar to a tensor fasciae lata. In fact, that's kind of the, yes, sir. Well, when we get to the posterior, that's going to be the posterior fibers. So the anterior fibers, just the ones in the front. Abduction pull, flexion pull, internal rotation. Okay. The ones in the back have the same abduction pull, extension pull, and lateral rotation. Let me see if my range of motion can do the yoink, yoink, and yoink. Make sense? Yoink. So the posterior fibers, let me see if this would work better since my arm can't, so this would be a left, okay. The posterior fibers cross, they go from the scapula to that deltoid tuberosity. They cross laterally, that's why they're abduction pullers. They cross posteriorly, that's why they're extension pullers. And they have an obliqueness to them, so the X component of that pull is why it's an external rotation. How many individual muscles make up the right deltoid? One. It's one muscle. So looking on our descriptors, deltoid, all heads, shoulder abductor. The anterior fibers pull this way and that way. The middle fibers pull this way, and the posterior fibers pull this way and that way. Now remember, this abduction pull is for all of them. So the anterior deltoid, it's a flexor, internal rotator, and an abductor, is what I'm trying to say. They all pull in the direction of abduction. And then specifically, these fibers have these unique individual pulls. All right, who's ready to learn about some rotator cuff muscles? Our lower extremity version of this was when we talked about those little lateral rotators. Gemellus superior, inferior, obturator, internus, externus, quadratus femoris, those little lateral rotators. The hip naturally puts more emphasis on stability. We've talked about why, because if you dislocate a hip, that's a bad, bad, bad day. If you dislocate a shoulder, that's a bad day, but you get to run away from danger. You can still move. If you dislocate your hip, that's a problem. So our socket in our hip is bigger. The muscles that cross the hip are a lot stronger, and we actually have extra ligamentous stability of the hip. The trade-off at the shoulder, because they're the same classification of joint. They're ball and sockets. The shoulder gives us a much shallower socket, like a golf ball on a golf tee, so that we can have a lot more motion, that we can do more things. We can throw from at distances, but the trade-off is stability. There has to be trade-offs. And so when we trade off this stability for mobility, we really rely on musculature. This one thing you've heard me say a lot, muscles don't just influence motion, they also aid in stability. And so the rotator cuff in general has a few functions individually, like in other words, each muscles have specific directions of motion they pull in, but collectively, not individually, but collectively, their job is to try to keep that golf ball on that golf tee. While, unlike in golf, our golf tee is moving. So imagine trying to keep a golf ball on a movable golf tee. So what I want you to notice here, regardless of what it is, we'll talk about them individually, but they are pulling the humeral head into the golf tee. Some of them kind of pull down and in, and I'm going to talk about why. And one of them on the top is pulling up and in, so they kind of cancel out the up and the down. But what they all have in common is they're literally just trying to make sure this doesn't happen, that doesn't happen. It's a tough job. It's a tough job for those rotator cuff muscles. And even tougher is rotator cuff muscles don't have the blood supply that I like to separate muscles into two categories: city muscles and country muscles. Has anybody ever heard this cliche like you may have a big offensive lineman from the country and they say big country, big country boy, country fed, In other words, in the country you have room to grow. Did you know that a goldfish, if you keep it in a little fish bowl, is going to stay small? But if that same goldfish went out into a big lake or pond, it would grow bigger. Okay? Country muscles are like the quads and the hamstrings and the pecs and the shoulders. They live out in the country. There's room to grow. But when you get into the joints, that's big city living. You have wiring, you have nerves, you have plumbing, and all of that has to fit intricately through those joints. So we limit these muscles' blood supply so that they don't get too big and take up the very limited space we have inside those joints. Does that make sense? So that's why when you tear like a rotator cuff muscle, you got to go in there and fix it a lot of times because the muscle lacks blood supply. All right. Another way to think of the rotator cuff muscles is a baseball analogy. We have three bases and a home plate. I get it. But you have four main rotator cuff muscles, and so you want to cover all your bases. Okay? Cover all your bases. So let's start with the subscapularis. I like this muscle because its name is descriptive. Remember how I said there's no consistency with these darn muscles. But subscapularis, what is a submarine? So a subscapularis, let's say here's the waterline, underneath the scapula, the subscapularis. See that red part on the inside of the scapula? That's where that muscle originates. The subscapularis, underneath on the inside of the scapula. I like to think, I know this is silly, but I like to think of my ribs as like a slice of bread and my scapula as a slice of bread, and the subscapularis is the deli meat that's in between the two slices of bread. And that deli meat, that meat comes from in between the scapula and the ribs. This doesn't let off, so I can't get my hands up in there. But it comes from the inside. So this view right here, guys, we literally took the ribs out so that we could see inside. But this would be an anterior view. And that subscapularis comes posterior to anterior, and it inserts on one of these little tuberosities. You got these little tuberosities here. You have your greater and your lesser. Look, the bicipital groove, you ever heard that word before? That's formed in between these two. So this little blue nub right here is where the subscapularis. Now we know pull. We know pull. So guys, imagine this. You have a muscle that's coming from the back, crosses the shoulder, and inserts right here on this little tubercle. So when it pulls, what direction of motion is it going to pull in? This is a left. Good. It's an internal rotator. The reason it's not an adductor or an abductor is because it's pulling right on the axis. The only axis it's influencing motion is the polar. So in other words, it's like right on the anterior posterior. It's not on top, it's not on the bottom, right on the head, right on the axis. Internal rotation puller. Does that make sense? It's an internal rotator. Subscapularis. On top of the subscapularis, not on top, is another descriptor muscle called the superior supraspinatus. Spine, you guys have heard the spine of the scapula, right? The spine. So this muscle lives on top of the spine. It's like the top apartment complex. Get the top floor, the bottom floor. Supraspinatus. Now this muscle is covering our top base. So it comes over the top and it's going to insert on this little bony tubercle right here. You see this little blue part? Bones adapt to stresses, specific adaptations to impose demands. You guys heard Wolff's Law, all that stuff. So the bicipital groove, where the biceps tendon is going to come through, is really created by this muscle tugging on the top and this muscle tugging on the bottom. It's like parting the seas over time of our humerus. That's what creates the little groove for that bicep to fit into. This muscle, the supraspinatus, crosses the polar axis. So it's not actually trying to spin in the transverse plane. It's an abduction pull. Does that make sense? However, it's still trying to draw the golf ball into the golf tee by pulling on the golf ball itself. All of these muscles, these rotator cuff muscles, are pulling on the golf ball itself. So we covered our front base, we covered our top base, and now it's time to talk about our double play combo. We have a little double play combo, which is if we had a superior muscle on top of the spine, makes sense we're going to have a muscle inferior to the spine. That's what the So this is a posterior view. This is a lateral view. So these two muscles, let's line up. There we go. So these two muscles are pulling, it would be like the back version of the subscap. In other words, they're coming posteriorly and they're pulling lateral. Does that make sense? Infraspinatus, teres minor, posterior crossings, lateral rotation pull. So each rotator cuff muscle has its own specific direction of pull. The cool thing is that they encapsulate the humeral head. So as a team, as a defense, they're all trying to draw that humeral head in. This one cancels out this rotation and draws in, down and in, and then this one's pulling up and in, so it cancels out with the down and in, and they're all just trying to pull it in, trying to keep that golf ball on that golf tee. How many of you have ever heard of impingement syndrome? Shoulder impingement, rotator cuff impingement. I'm showing you the purpose of one of the purposes of the rotator cuff muscle. Bless you. Bless you. When we raise our hips up, flexions or abductions, the socket of the hip actually pushes our femur down while our muscles pull it up. It's called a force couple. Okay, guys, would y'all mind slipping out the back door? There's a back door right there. It'll go right to the hall. So here's your socket. You use abductors or flexors. It makes sense that I want to push the head down so that the leg can come up. Okay. Our shoulder, because we don't have a traditional socket, there's no bone to push the humeral head down. Think about that for a second. Unlike here, where we have a socket to push the femoral head down, we don't have anything to push the humeral head down, but we still have muscles that's trying to lift the arms up. So one of two things can happen. Either our rotator cuff muscles pull the humeral head down while our muscles lift the arm up, or if these rotator cuff muscles don't do their job of pulling the humeral head down correctly, the humeral head will shift a little bit, and the acromion, this part of our scapula, that hook, it'll push the humeral head down. Why do we not want the acromion to push the head down? Because we have a muscle that lives on top of it called the supraspinatus. And if you're doing overhead work and that humeral head is getting pushed by that acromion, that supraspinatus muscle is getting pinched and irritated. And eventually it's going to hurt. And if you keep doing stuff, eventually it's going to tear. You know what it's like? It's like, it's not exactly like it, but have you ever played with a paper clip and you bend it a few times, and after several times of bending it, it just pops, right? So it's like when you pinch a muscle and work it, at the beginning it's nothing's wrong with it, but over the course of time, all of those little micro pulls eventually will. One of the biggest, and I'm just introducing you to these concepts, guys, in athletics, you know, we kind of makes me sad. We have off seasons in athletics. We can do rehab in the off season. We can do shoulder surgery in the off season. Because there's some people that work in the real world. There's no off season. You got to keep working through it. And they don't have athletic trainers. They don't have therapists, or they're afraid they're going to get, fired if they say so, right? So we have to be aware that there's different this while working at the Fontana Center. In kinesiology, a lot of times we apply our knowledge bigger, faster, stronger for optimal performance. But in work, we really want to try to be efficient, safe, ergonomic. Because again, some of these people don't have off seasons. There's no backup person just waiting. If they get hurt, they could jump in the game and play. Okay. So just take that into consideration. So our rotator cuff. Look on our circles. They have the functions of the rotator cuff, subscapularis, internal, infraspinatus, teres minor, externals, and then the supra is an abductor. And again, this is where I love some of the creativity I've seen in the past by some students. Like, you could self-color it. Like, I don't know, if you wanted to color the rotator cuff muscles purple, it's up to you. There's ways you can kind of. Any questions about the rotator cuff before we go on? There's a good view of the subscapularis. All right, let's talk about our biceps breakout. We have two heads. We have a long and a short. You're going to tell me the function. I'm going to give you some hints. The short head crosses the shoulder and it attaches on what we call the coracoid process of the scapula. That's like this the front hook. It's part of the scapula. Anterior crossing in front. So what do you think it's going to do to the shoulder? If it crosses in the front, it's going to be a shoulder flexor. Absolutely. Shoulder flexor. The long head has an anterolateral crossing. Not all the way on the side, not all the way in the front. Somewhere in the middle. So the anterior part of that anterolateral is going to be a flexion fold, but the lateral part of that anterolateral is going to be an abduction fold. That abduction pull is very important for two reasons. One is a stability reason. If you have a string that has a nice lateral crossing, doesn't it make sense? It's going to kind of help to keep the golf ball even further from popping out, right? However, it has a very similar pull to the supraspinatus. You see that little prominence right there, that little greater tuberosity right there. So the supraspinatus comes through the little tunnel and it pulls here. The biceps brachii literally passes like right underneath it and runs a similar way. So when your supraspinatus is irritated, inflamed, and its role as an abductor is limited because of pain, your biceps brachii long head is going to compensate for it and work harder as an abductor because his buddy is in pain. And because the biceps brachii long head is doing more than it normally does, if you don't modify your work and if you keep working, guess who's going to get injured eventually too? The bicep here. So a lot of times biceps tendonitis is secondary to rotator cuff tendonitis. So the biceps got to take up some slack. In addition, I'm not holding you accountable for the test because, guys, biomechanics, there's a lot of stuff you got to go down the rabbit hole in your own journeys. But remember, we talked about midway muscles, or muscles that can have different function based off of position. Labrum tears. You ever heard of a labrum tear? The labrum is basically the little suction cup on your shoulder that tries to give it a little bit of extra stability because of negative pressure in here. Where your biceps brachii inserts right through that labrum. So the biceps brachii being pulled off is how you tear that suction cup. Now, why does the bicep brachii tear off? Macro reasons, but your biceps helps to slow down rotation because it spirals through. So if you think about it, if you internally rotate that shoulder, you're going to lengthen it, spiraling it around. So it can help slow down external rotation because of, think of it like this, guys. In anatomical position, we're here. When I do this, that muscle literally spirals around my shoulder. Again, not going to be on the test, but I did want to plant that seed if you're like, I wonder why the biceps always get hurt. So what do the biceps brachii short head? What does it do? It's a shoulder flexor. The long head is a shoulder flexor, shoulder abductor. All right. Coracobrachialis. Coracobrachialis is a simple shoulder flexor. It has the same crossing as the biceps brachii short head. In other words, they cross the shoulder the same way. They both go up to that coracoid process. This is again like another example of a origin insertion type muscle, sternocleidomastoid. Coracobrachialis, coracoid process to the brachial part of the. Another example of the coracobrachialis. What I like about this view, because this view really doesn't, we've done this enough where views are limited to what you can see. So if I tell you this is an anterior view, it makes sense that it has to cross in the front, because if it moved, I wouldn't see that muscle, right? But I love this picture more because that lateral view shows you the anterior crossing. Like it shows you, because that coracoid process is more in the front. So it shows you how it will pull in the direction of shoulder flexion. I like that picture. Here's a famous muscle. Don't look at your references. Let's just look at the muscle. Now, unlike the rotators, remember the rotator cuff muscles are pulling on the golf ball. This isn't pulling on the golf ball. This is pulling like on the stick, right? So it will be crossing our anterior posterior axis. Just look at it. How would it pull in anatomical position? How would it pull? Add or add? Add. Adduction pull. What about rotation-wise? Absolutely. Internal rotation pull. Here's your humerus. While it's on my mind, this may help you in a grad school. You see these three little blue slits? These three little blue slits right here? We were taught a lady, that's your latissimus dorsi, lati, a lady between two majors. So you're going to have your pectoralis major, and we're going to talk about it, the teres major later. So this big slit right there is the insertion of the pectoralis major. So in anatomical position, you can see I'd be an adduction puller and an internal rotation. Two majors, like think of it like the military, like a lady between two majors. Lady is lati, latissimus dorsi, between two majors, pec major and teres. All right, guys, thinking caps time. I think this is cool, but then again, I'm probably on the spectrum. In anatomical position, the pectoralis major is an adduction point. When we abduct, when we get to 90 degrees, it's no longer trying to pull in adduction. At 90 degrees, now it's kind of on the anterior posterior axis. Its only pull when we're at 90 degrees would be to try to pull this way, horizontal adductor. Make sense? Okay. Now here's where things get really neat. Globally, it's just trying to bring the humerus in. When I'm below 90 degrees, bringing the humerus in is an adduction. But when I'm past 90 degrees, bringing the humerus in is an abduction. You see that? So the pectoralis major in anatomical position and up to 90 degrees is an adductor. But when we go past 90 degrees, it's an abductor. Which makes a lot of sense. It's like if you're shoulder pressing a lot of weight, then it makes sense you kind of want a little extra help up here. Down here, up here, it's an example of a brachioradialis type muscle that can switch its function depending on your position. Who knows, you don't have to know a lot about it, but how many of you every 4 years watch some gymnastics on the Olympics? There's a move that the guys do, because I don't think the women do the rings, the rings exercise. And there's a move called the iron cross, where they literally hold themselves out on the rings. Anybody familiar with that? They get extra points if they can go like parallel, right? If they could go here. It's easier for them if they're slightly adducted from that position. And one of the reasons is because if you're below 90, you get to use your pectoralis major as an adductor. But as soon as you go here, that pectoralis major is like, dude, all I can do is pull you across. I can no longer hold it down. So that's kind of one of the neat little tricks. Like the difference between being here and there is you literally lose one of your big shoulder injuries. So why would the pectoralis major be listed as an adductor? Because in anatomical position, that's where we are. Okay. All right. Your pectoralis major, because it's a fan shape, we've had anterior fibers of the gluteus medius and minimus. We've had anterior, posterior fibers of our deltoid. We're going to have fibers of our trapezius when we get to scapula. So for our pec, we have sternal fibers and we have clavicular fibers. Some people refer to it as upper and lower. Potato. But what I want you to make note of is when we learn the vectors, look how these fibers are like X, and these fibers are a combination of X and Y. So the X component still has the same function as all of these. However, because this has a Y component, it's the Y component that would be shoulder flexion shapes. That's why the upper pec, the clavicular fibers are shoulder flexors. Make sense? Now, there's a misconception about lower fibers. It's not that globally we don't have some high and some low. It's just that practically speaking, there's nothing different that these lower fibers would do. Because the shoulder in anatomical position, all the fibers pull in the direction of adduction, all of them. Does that make sense? So in other words, practically speaking, the lower fibers, I wouldn't be isolating the lower fibers here because all the fibers do that. It wouldn't be anything unique that they do. And we're going to talk about it when we get into the latissimus dorsi. But one of the reasons you feel stronger when you're doing a decline is because in addition to the pectoralis major, that you create an adduction. You need adductors when you go decline. So your latissimus dorsi, which is one of your biggest, strongest muscles in the body, literally gets to work with your lat, which is one of the biggest, strongest muscles in your body. And you get a twofer in that decline because you're using adduction pullers, and the latissimus dorsi is light. That's why you feel stronger, and you can do more on that decline because you get lat and pec working on the same team. If you get lat and pec working on the same team, it's a pretty good team. Let's take a look at this triceps brachii. Medial head doesn't cross the shoulder, lateral head doesn't cross the shoulder, long head crosses the shoulder. I want to bring up or point out though, see this little red notch? This little red notch right here. Guys, this is right underneath the golf tee. This is where the tricep inserts or originates, potato at the top. If the tricep started like on the spine, like back here, 100% it would have an extension. But it's literally right underneath the socket. It's like on the axis. Doesn't cross posterior. So if you look at it, you're like, well, how does it cross? It would be like an adductor. Remember when we looked at the adductors at the hip? I think the reason that most people feel the tricep is an extensor at the shoulder is because when we do like straight arm stuff, our tricep is on preventing the elbow from flexing. Does that make sense? Like it's on as an elbow extensor, and so we feel that, and we give credit to it at the shoulder, and really it's just creating a rigid link at the elbow. I think it's kind of cool. You have your biceps brachii long head on the top of the golf tee, and then you have your triceps brachii long head at the bottom of the golf tee. Kind of neat. All right, that's enough for today. Let's go, not that I'm going to end class, but let's go back and look at our, and check some boxes. Biceps brachii short head, shoulder flexor. Biceps brachii long head, shoulder flexor, shoulder adductor, anterolateral crossing. Okay. Coracobrachialis, shoulder flexor. Supraspinatus, rotator cuff, that's an abductor. It's pulling up and in. The other rotator cuff muscles are also pulling in, but they're pulling down and in. Subscapularis is an internal rotator. Infraspinatus teres minor are lateral rotators. We talked about the deltoid, one muscle. The anterior fibers are, in addition to abduction pull, they have flexion pull and internal rotation pull. When you're doing lateral raises and you need the abductors, it's super convenient that the anterior fibers would be canceled by the posterior fibers sagittally and transversely, and they can work together synergistically just to pull the lateral. And then finally, we talked about today the triceps brachii long head and the pectoralis major. All of the fibers in anatomical position are adductor internal rotators, and only the clavicular fibers cross in front. It's a lot. But what I'm hoping is the shoulder muscles are kind of like rock stars, but I'm hoping that you might have heard some of these before at least. And we're just looking at again how they cross so that we can see direction of pull. And then we'll apply the stuff we've been applying for weeks now. How would I stretch internal rotators? I want to externally rotate the shoulder to stretch internal rotators. How do I stretch external rotators? I want to internally rotate to stretch externals. I want to flex to stretch extensors. I want to extend to stretch flexors. Obviously, we'll do some practical examples, working abductors, working flexors, eccentric, concentric, all that stuff should be I would think we would need to spend less time on the practical examples because it's the same concepts, just in different places. Any questions? All right, we're good? If you guys need me, we're gonna have to do virtual today because we're still doing interviews for those faculty positions. But you know, I'm always available, bless you. I'm gonna say it again. The reason I do 24/7, I'm awake, is because every single one of you have different schedules, work, family. I don't know when you can study. And so when you do study and you have a question, I don't want you to have to wait till Monday to get it answered. I want you to be able to get your question answered so that you can keep studying in the unique time window you have, okay? That's what I do. All right, guys, y'all have a good one. Please be safe.